Welcome to those who are just joining us for the 2022 Fruhoff Symposium on the Shepherd Higher Education Consortium on Poverty. I'm Tim Diette, and I'm the Executive Director of the Shepherd Higher Education Consortium. In terms of housekeeping, just a reminder, the session is being recorded. You can keep your cameras off and microphones muted until you're asking questions at the end. So we are in for a real treat this morning. I'm thrilled to be able to introduce to you Dr. Lisa Gennetian. I pronounced that correctly. Excellent. She is the Pritzker Professor of Early Learning and Policy Studies at the Sanford School of Public Policy and faculty affiliate in the Center for Child and Family Policy at Duke University. Dr. Gennetian is a leading scholar in areas concerning child poverty with a particular focus on understanding causal mechanisms underlying how child poverty shapes children's development. While she merits a much longer introduction, I want to make the most of our time. I would encourage you to visit Dr. Gennetian's Duke University webpage, where you can explore her incredibly long list of publications, grants, some coverage in the media. And so excellent perusing after this talk. So with that, we'll turn to you, Dr. Gennetian. So I'll start off with a question. So you do have that, as I mentioned, an incredibly long list of publications, and in looking through that, sort of one theme that certainly jumps out is how your research is helping us understand child and family poverty, why it matters, and assessing policies and programs that might address these issues. To set the context for our conversation in the audience, could you talk a little bit about child poverty in the U.S. and the existing safety net programs?
Yes, I'd love to. And thank you for inviting me today. Let me first start there. It's really a pleasure to speak to you and students. This is one of the great joys of my career right now. I don't know if I have share screen capability. We talked about me possibly popping up some slides while I sort of set the context for child poverty. So I think I just need to be a co-host.
All right,
I'm ready.
Cassie will get to work on that behind the scenes.
Okay, that's terrific. Okay, so let me start with just some context of poverty in the US. One important thing to remember is we didn't start measuring poverty, child poverty in this country until the 1960s. And it was really out of abundance of concern over food and hunger. And so indeed, our poverty measure, the absolute poverty measure in the US, is designed to cover a food budget. It was developed by Molly Orshansky from the US Department of Agriculture. I like to start there because I think people kind of forget the history. And in their frustration of understanding poverty and why it's so low, the poverty level, it's in part because it started with this history. Do I have share screen now?
I think so. Yeah.
Okay, cool. That's
great.
Okay. So, okay. Can everyone see this slide here?
Yep.
Okay, perfect. Okay, I'm gonna just get rid of the animation, try to set the context here. So this is a slide pulled from a really fantastic recent report. It was published in 2019 by the National Academy of Sciences, where they were charged with the task of evaluating and assessing how the US could reduce child poverty in half, right, in 10 years. So you can see here is the time frame of about the 1960s when the official poverty measure started. And I mentioned it's already based on kind of number of families that are related to each other in a household and covering a basic food budget. And so it started about 17% for children in poverty in the 60s. Improved or increased quite a bit through the 1980s and 90s, and then dipped. And before the pandemic was about roughly 1 in 5 children in the US. So poverty, you can look at this trend line, you can say, wow, child poverty hasn't moved. There might be a number of things that surprise you. Let me start with one thing. When we talk about child poverty and in terms of income level, this is evaluated on, a base income level of $20,000 to $25,000. So keep that in mind annually, adjusted for inflation. The second thing that might strike you is, my goodness, we haven't shifted child poverty very much over time. If you look at this orange line, right, for the last 50, 60 years. But then a third thing might strike you, which is, well, there are some bumps here. So what's going on? And then I should add the fourth thing, which is the composition of who children are. So their demographic characteristics has also shifted quite a bit over this time period. And so you see here on the right, while 1 in 5 is a general statistic, on the official poverty measure, we see enormous differences across racial ethnic groups. So Black and Hispanic children who are Black or Latino are much more likely to be in poverty than other groups. Okay, so now what is this? You might ask this question, Lisa, or Professor Gennetian. We've had, enormous growth in safety net programs, right? This was kind of your starting question. So how do we figure out whether those safety net programs are actually making a dent in child poverty? And I want to give you sort of 2 charts to jump as a jumping off point for that. One is the introduction of something called the supplemental poverty measure. Now, the SPM did not really start until recently. It's only about 20 years old. But it did come out of this notion that the official poverty measure does not take into account all the things, right, all the public investments that the US has engaged in to try to tackle child poverty. So how are we to understand what this trend, how much this trend line is really moving if we don't adjust for that, the transfers that families are receiving or extra income from safety net programs? And if we don't adjust for other things like cost of living expenses, which we know varies quite a bit across the country. So this measure, the supplemental poverty measure, is actually arguably a more accurate sort of picture. It makes some assumptions. One is that every child is getting these benefits, but let's put that aside. And when you look at the supplemental poverty measure, you indeed see that child poverty was much higher in the 1960s. That's because we didn't have many of the current safety net programs. And you see a really consistent downward trend, right? And you see that trend even during a recessionary period, the last big one being in the 2008-2010 period, which means that some of our safety net programs were actually really reasonable cushions to protect children, even during economic downturns. So before the pandemic, we were sort of gliding to a trend in which we were really making some progress in child poverty. So let's step back and try to ask ourselves, well, what's going on with these safety net programs through the last several decades? This is a chart from an analysis by colleagues Marianne Bittler, Hilary Hoynes, and Diane Chazenbach. It's one of my favorite charts in this entire paper, and it's been relegated to the appendix. And the reason why I love this chart is it focuses on anti-poverty effects. And
I don't think the chart advanced for us.
oh no.
I think because we're still on it was gliding to good news on so we have the supplemental still.
Okay, you still can't see this?
I can only see it in the small little version. So
Interesting. Let's try this again. How about this?
There we go.
Excellent. Okay. All right, so let's talk through these programs. And so just to orient everyone, so here's the vertical axis is the anti-poverty effects. Okay, so this is sort of what percentage point impact is being made on that trend line for these various safety net programs. And what's neat about this chart is really breaking out for different age groups. So we've got 18 to 64-year-olds with no children in orange, 18 to 64-year-olds with children in green, children in blue, and then elderly in yellow. And the way these programs are sort of on the horizontal axis, right, they're kind of organized by relative impact. And you see here on the left that one of the most successful, right, anti-poverty programs we have in the US today is through the tax system. And there are 2 types of tax policies prior to what happened in 2021. One is the earned income tax credit. That's had an enormous effect. So this is a refund, usually dispersed in a lump sum to families who have some kind of formal earnings and file their taxes. When families get these lump sums, they're $3,000 to $5,000 on average per year. It, of course, has a big anti-poverty effect. There are also a number of other kind of child tax credits that also work through the tax system. Again, that preceded what was happening in 2021. So this is what we do through our tax system has a very big anti-poverty effect, and especially for children. You see this big blue bar. Our next big program is SNAP, right? So that's vouchers for food. And those are dispersed these days through a benefit card. Looks like a credit card or a debit card. And SNAP benefits, so Supplemental Nutrition Assistance Program is formally what it's called. It's administered through the USDA, also has an enormous impact for children here, particularly in reducing food insecurity and hunger. And then we have a number of other programs. Social Security program, which is designed and in terms of affecting children for children who live in families with a disabled adult. Housing assistance. So this is either a voucher program to pay for housing costs or public housing. School lunch program, of course, has a very big impact, breakfast, as well as other types of meals. A pretty small impact is what used to be our big cash assistance program. This used to be called Aid to Families with Dependent Children. It converted over to something called Temporary Assistance for Needy Families in the late 1990s. I've actually done a lot of work evaluating this type of program. And the reality of this program today is that the funds are dispersed to states and localities. And that money is then dispersed through a variety of different types of programs. Not all of them, while some of them may implicitly affect children, not all of them go to cash assistance. And so we don't see a very big impact here. Unemployment insurance, the Women's, Infant, and Children program, which is a kind of supplemental food and nutrition program designed for families with very young children, has a actually pretty big impact on children. The reason why it's small here is because it's targeted to children 0 to 5-year-olds. So if I were to draw a big square, here are our big safety net programs prior to the pandemic, right? That each of them, and bundled, and often families are connected through multiple programs here, can have real impacts covering food, housing. Medicaid is not in here, so it's health insurance, and then cash. So what is this funny thing on the right? And you'll notice on the right, something happens. One thing that happens is the vertical scaling changes, right? Instead of going from 0% to 8%, we've got 0 to 40%. And something else is visibly very apparent here, and that is this yellow bar is just huge. And so what's happening on the right here is demonstrating the impact of another really, really effective anti-poverty program called Social Security. That was actually implemented much earlier than the 1960s. Social Security is a monthly check. It goes out to the elderly, and it's had an enormous impact on reducing elderly poverty. I love this chart in part because it really demonstrates what commitment and kind of political will, and that we do have strategies, we know how to tackle poverty. We did it for the elderly. How can we do it for children? So let me stop share there as sort of a, I have one more chart, but let me stop share for a second so we can keep the conversation going.
Okay.
Yeah.
So you mentioned cash transfer, at least one cash transfer program there, or a couple. And certainly we've heard some candidates recently in some elections talking about different sorts of cash transfer programs. I wonder if you could and I've heard about some different experiments. So just curious if you could tell us a little more about what's going on in the world of cash transfers at the moment.
Yeah, well, my upshot there is a lot, incredible. And, as a scholar who's been sort of working in this space for over 2 decades, these conversations are brand new to the table. They were just not something where there was any kind of appetite certainly not from a federal political perspective. So there's lots of really exciting things going on. Let me first start with, there is a very exciting sort of ground up effort that's coming from the place of moral and economic justice and human dignity. And that kind of portfolio of work is about providing basic income, and that every kind of individual in American society should have a floor of income. And that has inspired a number of pilots. You might have heard of the Stockton experiment. So Mayor Michael Tubbs was behind that. And he was actually, a real innovator. That has now grown into, I think there's something like 88 pilots being run by mayors across the US. It's phenomenal, right? So this is something over the course of like 7 or 8 years. And these are in part being organized, so it's called Mayors for Guaranteed Income. They are organized, some of them, through a Center for Guaranteed Income at the University of Pennsylvania. They follow some, basic metrics of pure cash going to families or other individuals. The populations are different. And there's a concerted effort to collect data from these folks and see what we can learn. So that's sort of one body of work that's happening. It's very exciting. There's a second body of work that is getting a little bit, that was inspired through the pandemic, actually. And that is, the pandemic really gave all of us a big shock in lots of ways. But one big shock to the system was the economy. And there was, real concern about the economy and how people were going to meet their basic needs, given what was happening also to the labor market. So those joint things kind of really inspired efforts to also distribute cash to US families. And that was sort of unprecedented, right? So there were a few what we call stimulus checks. These were one-time lump sum transfers to folks. And then there was another really innovative policy, which was something called the expanded child tax credit. And that was a one-year endeavor to, again, work through the tax system and give families with children a refundable, monthly, predictable amount of income. And that was legislated for 1 year, so lasted for 1 year. Those checks started going out in July 2021, and it kind of wrapped up since then. There are still families now getting them, because if you didn't get them, you can actually still file and get last year's income, just as FYI. So families are still getting them. That amount, so the stimulus checks were sort of lump sum transfers in the amounts of $1,000, $1,200, and there were 3 kind of these doses. This monthly child tax credit was it was much more generous. And it had a much higher amount for families with very young children. And it was a per child tax credit, right? So if you had 3 children, you had 3 times the amount of income from this child tax credit. So that's sort of the second kind of policy-oriented infusions of income that are going in. And if you look at what happened in child poverty, you can see what you might expect, which is when that money went out, you see child poverty really dipping. And in fact, because those efforts, it's questionable whether they're going to continue. There's no effort right now to at least conversation in an active way about continuing to extend the expanded child tax credit. There are real concerns about what's going to happen with child poverty, absent any other, right, expansions in the safety net. So the third thing that's going on, and I'm going to like nerd out a little bit in the research space, is scholars like me are doing some innovative work trying to understand the impacts of direct cash with no strings attached, which you can characterize as like poverty reduction strategies, and trying to really empirically, right, understand what impacts those strategies have on the targeted people. In my case, it's families with children, especially families with really young children. And I find that sometimes when we have these conversations about the importance for research, sometimes people are surprised. Well, isn't it obvious? You kind of get that question, isn't it obvious? And the reason why it's not obvious in the US goes back to this 50, 60-year history of these safety net programs that I just reviewed. But one thing about the safety net programs is they're all conditioned or targeted in some specific way, right? So you only get the earned income tax credit if you've proven you've worked. Food stamps are wonderful, but you can only buy food, right? Now, it might like alleviate your budget to buy other things, but it's very targeted. Housing assistance is really, really important. It goes toward housing. And economists really wrestle with those trade-offs, but it remains controversial, animated, about what people will do, especially people with low incomes, with the money if they're given sort of cash in particular with no strings attached. And so it's a really, open, important question. And I hope the scholarship that's coming out will help kind of close the loop and answer some really important questions about impacts.
Well, speaking of that scholarship, you are the principal or one of the principal investigators of the baby's first years study.
Yeah.
Can you talk to us, so share all for the audience? So what is that study, and do you have any preliminary findings?
Yeah, I would love to. All right, so I'm going to go back to I'm going to attempt some share screen. Let's see is that okay? Yeah. Let's see. Okay. So Tim, I will rely on your head nods about, okay, great. So I do have a set of slides here, and hopefully I can go through them pretty seamlessly, but let me know. So indeed, I am lucky enough to be one of the principal investigators of a study called Baby's First Years. We just came up with this QR code, so this is an easy way to quickly get a link to the website, and I encourage everyone to do that. We have a lot of good information there. The slide is moving forward.
Yeah.
Okay, wonderful. So Baby's First Years is a study that is a labor of love. It is a group of diverse disciplines coming together, primarily from neuroscience and the social and behavioral sciences, to really understand and answer the question about the impact of poverty reduction in the very first sensitive years of children's development, and to inform that question through measuring children's brain development in particular. And that's been the real important contribution of the neuro and brain scientists. We have been meeting and designing and working on this study for 12 years. So this is a very big effort. We're really lucky to have lots of support financially. This is sort of you can see this on the right screen. And so the names of all the scholars I've been privileged to work with are here in terms of principal investigators. You know, the list of who we're working with is very, very long. Let me tell you a little bit about this study. So it was really inspired out of a really broad literature that showed associations between early changes in income and the impact that can have on children. And so one example of this is here, that a $4,000 difference in early childhood, so targeted during those 0 to 3 or 0 to 5-year-old period. Annual family income, that kind of magnitude of an increase can predict subsequent children's cognitive development, their earnings when they become adults, their employment, their health. The list can go on. And there's been lots of, going back to those safety net programs, you know, a huge body of really important work that also specifically kind of examines the rollout of those programs over time, for example, or other types of randomized control kind of innovations to understand the impacts of those programs on children's development. And over again, right, we have a real kind of collection of evidence that points to when poverty is reduced via income boosts from those types of programs, we see benefits to children. So what's missing? One thing that is missing from the literature is specifically whether or not poverty reduction during the 0 to 3-year-old period can have the impact that we think it can, particularly on brain development, where brains are most kind of actively growing and children are very, very sensitive to experiences. The work that I just talked about, the quasi-experimental work on tax and transfer programs, is not really designed well, right, to answer that question. Some of it is just because those programs have not kicked in historically during the early years. Some of it is also because it's really hard to measure children's development, right? With a 2-year-old, you can't ask a 2-year-old whether they're reading well, right? You can't ask a teacher. So, you know, measuring development during those early years is very expensive, and there aren't many options, which is where measuring the brain is really novel. And so we're bringing together those two kind of missing pieces of literature when we launched this design. So here's what we did. Starting in May 2018, we recruited 1,000 low-income mothers in hospital maternity wards. They were all well baby and healthy babies at birth. We did this across 12 hospitals in 4 metro areas: New Orleans, Omaha, Twin Cities, and New York City. Moms were first approached about their interest in participating in a child development study. And after they consented, we then collected some basic demographic information about them. And then we asked if they were interested in participating in this randomized controlled trial, right? We describe it as a lottery, and you'd be eligible to get a high cash gift amount or a low cash gift amount. So those moms who consented were then randomized to receive one of two things: $333 a month, which is about $4,000 a year, and you'll make that connection with the literature that I just set up a little while ago, so that was intentional. Or a low cash gift amount, which is $20 a month or $240 per year. So every family that consented and got randomized is getting something. So originally, when we started this study, our plan was to allocate the cash gift for 40 months and have a really intensive child development data collection when the babies turned age 3. But then the pandemic happened, which meant we couldn't visit these kiddos in person, which is really important for these child development measures. Our philanthropic partners were really generous, and we were able to fundraise. So we extended that cash gift to 52 months, so that we are in the field now. Actually, I'll tell you a little bit about the data collection, because we can now visit them in person. They're actually coming to the universities. And just 6 weeks ago, we went through another fundraising cycle, and we are actually going to extend this cash gift. So this monthly amount of $333 will continue until these children are 6 years old. One of the beauties of working with an interdisciplinary team is that we bring kind of different ways of thinking about how cash like this might impact families. And so we've used this framework that has really organized the way, like the measures that we collect, and indeed how we're thinking about publications and analyses. So this is sort of really scoping out, but it's really helpful, right? And so we have two big theories that we think are the mechanisms of change. One is that higher income or poverty reduction will increase kind of investments in children's environments. These are things like childcare, quality of housing, quality of the neighborhood, parents making decisions about work, and time spent with children. And then the second pathway, so that first pathway really comes out of the discipline of economics. The second pathway, which is reduced stress, really comes out of family science and developmental psychology and psychology. And so here the theory is, by reducing the financial stress associated with low and unstable resources, we may alleviate kind of the mental bandwidth and the other sort of factors that contribute to being a nurturing, warm, caring, responsive parent. And so these together are then hypothesized to positively affect children's cognitive, socio-emotional, and brain development. So how are we distributing this cash? It's actually not an easy thing to do in the US. It took us actually a couple of years to figure this out. We landed on, and in part this is challenging because not everyone is tied to the tax system. I just mentioned that, or a safety net program. Not everyone has a bank account. We were very aware that, checks sometimes come with fees. And so we landed on a debit card, and this is what it looks like on the right. This card is automatically activated at the hospital after parents consented. The money is dispersed very predictably on the day of the child's birthday. It has this little logo called For My Baby. It's intentionally green. We actually did our research, so it looks different than all the other kind of EBT cards in these sites. And then it's accompanied with a monthly text reminder. So the money that goes to the families is completely coming from charitable sources. It is not through the National Institute of Health or other kind of public agencies. They will not be in the business of funding those, cash intervention. So that also gave us some interesting kind of challenges. One is we wanted to make sure that this increase in money would not count against, right, eligibility for other types of programs. We went about that in a very rigorous and complicated way. We worked really closely with each of the states and the cities and counties. We have a number of kind of administrative rulings and interpretations in place. And in fact, 2 of the states, in Minnesota and in Nebraska, we have official legislation that protects these families from the cash counting against their benefits. Yeah, that was, I'm glad you said, wow, that was like a really big deal. that was a lot of work. So, you know, the money that goes in this card, there's no Social Security required, it's not taxable. And to the extent possible, it doesn't count against government benefits. And so far, you know, we've dispersed about $6 million in the hands of the moms. We are learning lots of cool things about the cash. Again, with their consent, we can actually see how the cards are being used. And I'm just giving you kind of a zoomed out look here. So on the right, you can see like these are the various types of vendors that families are using. And, you know, right away, you see what you expect everyone does, right? So first of all, a really interesting finding, I think, is that the money goes on the card, and the largest kind of thing that we see is withdrawals through ATM. So actually getting cash. This is a MasterCard, so the footprint is actually pretty broad in the US. But then outside of that, you see general big box and wholesale, and then a whole diversity of uses of this cash. On good news, there were very few problems. The card works really well. We do have a hotline to address problems. Cash is drained off the card each month. This is a pretty consistent pattern that we see. About a third is withdrawn at ATMs. There is a whole diversity of transactions. And we see very few transactions. You know, this is something that comes up in this literature that we haven't quite talked about. I'm happy to talk some more about. It goes back to this, you know, can we trust families, especially low-income families with more income, confounding what we're seeing in associations of other types of behaviors. And so, you know, we see very little of money being used towards temptation goods, right? Tobacco or alcohol, as one example. And casinos, actually, that's another category that we can see through these cards. So I mentioned that we have a really rigorous data collection. We stay in touch with the families actually every 3 months. And every year we do what we can in collecting data. We've been, you know, redirected to phone because of the pandemic. We just finished, I didn't even update it for today. I literally just finished like last week. Our wave 3 data collection. So this is when the children were 3 years old. We just started our age 4 data collection. So each site is now seeing the families. They're coming into the universities, and there's like about a 2-hour assessment of children's development as well as the parents. So we have at this point a lot of data that we are trying to analyze now and to produce some, you know, papers and briefs to get out into the world. But I will give you a little. Let me just pop all this up. This still looks good. Okay. So in terms of where we sit today and our findings, we know the most about what happened in that first year. And we are finding some really interesting things, including some surprises. So first off, we are seeing a reduction in poverty. And so if you calculate all the other sources of income that families are receiving, and you add on the cash gift, on net, families have more income. I always like to, you know, I think it's really important to remember that while we're reducing poverty, there are very few, like less than 10% of these families that are actually have enough income that would put them above 200% of the poverty level, right? So we're moving families from at poverty to just above poverty. We're seeing increased maternal engagement in things like reading and telling stories and playing with the infant. It's a positive impact. And we're seeing this with no offsets, right? No changes in mom's work, including timing of re-entry into the workforce after having the baby. We're seeing no impact so far in that infant year on time in children's time in non-parental care. In spending, we're seeing more spending on child-specific goods. Some of these are durable goods like cribs and safety devices for the home. But we're also seeing things like books and toys and children's clothing and diapers. So the money seems to be going, you know, relative to what's happening with the low cash gift group, more incrementally towards those goods. We're seeing no other changes in other types of goods, including food, utilities. We ask about alcohol and tobacco, so we're not seeing impacts on those types of expenditures. One thing that's been surprising, and we spend a lot of time trying to measure how moms are doing, their psychological health, their parenting stress. I mean, we're so far not seeing any improvements on those metrics. So that's, that's sort of giving us some pause and thinking about how complicated and stressful probably these environments are. And then while we were in the field in person, we had to switch gears because of the pandemic during this wave 1 data collection. But while we were in the field in person, we kind of piloted an innovative way to collect brain development with portable EEG machines. So we had the survey researchers actually going out into the field and measuring children's brain activity. And for that subsample, we saw infants in the families that were receiving the high cash amounts showing more fast-paced brain activity. And my neuroscientist colleagues have, talk about how this type of fast-paced brain activity is in a pattern associated with the development of subsequent thinking and learning. So that's, a very positive, exciting finding for a subsample. And we're really, looking forward to being in the field now and collecting brain development measures again to see if this is sort of holding up and if it's actually holding up for the larger sample. And after receiving, 48 months of income, cumulative income. So I'm going to stop on that one. I do have, let me just quickly mention one of the other wonderful things about this study that might be interesting to this group. So we're also, we have what we call qualitative sub-study. This just means that, it's very hard when we focus on quantitative metrics. It's hard to get real texture of experience. And so one of our colleagues, Sarah Helper-Meakin, is spending a lot of time talking to moms and in 2 of our sites in Minnesota and New Orleans. And we've learned a lot, right? How they feel about the extra income, the struggles and joys of parenting. And here's some examples of things that we're learning for them. So Camille, a 26-year-old white mother of 2 who's getting the high cash in the study, she talked about how her lights were actually off and she was stressed out in the hospital, wondering how she was going to get those lights on because she just had a baby. And then this interviewer came, right, and told her that she was going to have $300 a month. And she said, ain't nothing but the Lord because my lights was off. Yeah, I want to cry because they were there. And so we got a lot of stories about kind of the miracle and joy of just finding out that suddenly I'm going to have this money and I can bring my baby home in an environment that's safe and secure. Nina, a 26-year-old Black high gift mother of 4 from New Orleans, credits the BFY money with helping her manage her financial challenges, reduce her stress, and buy her kids a few extras. It just seemed like that money always can't come when we're at our lowest. It'd just be like weight be lifted off my shoulders, because knowing that I'd be here stressing, like how I'm going to get it done, how I'm going to do it, it'd be like so much weight lifted off my shoulders, so much weight lifted off my shoulders, like a lot. Like I can't accomplish everything that I want, but I can accomplish the things that I need to get done. Really powerful sentiment. And then this last one, I think this is Isabel. This is interesting, kind of how Isabel and her spouse have been thinking about the money and, early skepticism maybe about it. He was like, do we have to pay this money back? And I was like, no. He was like, well, we need to use that money, right? And that's what we've been trying to do. Don't spend your money on that. He tells me, don't spend the money, save it. And I'm like, save what? I can't pause my kids. You know what I'm saying? Like if I need something in the house, that money will be spent for the fact that I need it in the house. It could be stuff to clean my house. It's going to be spent.
Yeah. Well, I'd love to ask a bunch more questions and maybe others will jump in, but I want to allow time. I just want to touch on one other of the many things you've done, and that is the rebalancing children.
Oh, yes, yeah.
And so so for the audience, so that was a bipartisan group. We talked earlier about the very prickly political environment and the challenge of doing good research, and but there are things that we can agree on. And so that was an effort put together by the American Enterprise Institute and the Brookings Institute to examine national investments towards children. And that the report that came out, if I'm remembering correctly, was a consensus report of a broad sort of I might say political spectrum. Is that fair of economists? And I just wondering if you could talk a little bit about the process of working towards consensus, and then we'll go from there into other questions. So if you're in the audience, be thinking of questions you might want to ask.
Okay, yeah, that's terrific. So let's see, let me start with, it's very hard. But maybe I can just lay out sort of how this was organized and what we did. Would that be
That'd be great.
That'd be helpful? Okay. So indeed, so this was the two kind of leads on this effort were Diane Schausenbach, and so she was sort of representing the Brookings side, and Michael Strain, who was representing the American Enterprise Institute, and indeed both of them are trained in economics, which is kind of important. So they wanted to come together and kind of, I don't know, maybe this is sort of like the pulse and the proof test. Like, can we actually get both sides around a table to agree on investing in children? And then there were a variety of academics. So I was one of the academics that was invited to the group. So what led to the successes of this group? I mean, we worked together for about 3 years. So again, like everything else, we had some disruptions because of the pandemic. I think the original plan was supposed to be like 2 years. But I think that actually ended up with some benefits because it really fine-tuned our insights after the pandemic happened. And it was a series. I mean, we met once a month. We met in person as much as we could. We traded places. We met at Brookings, and then we met at AEI. AEI's food is much better, FYI. This became like a little running joke. I think one thing that really helped us move forward, well, I should say a couple things. One is agreement from the get-go from the two leaders, right, Michael and Diane, that we're going to make this work. Like there is going to be an end product here. And we're going to be, they set the tone of very, very high respect of hearing, right, everyone's perspectives, and very talented at kind of negotiating. So there are literally, if you had me sit down, I could pull out the exact sentences in which we spent like probably a year, right, agreeing on. And that was an incredible learning experience for me, like how you do that and how do you kind of negotiate and come up with language that we can all agree with. So that was pretty phenomenal. I think the other thing that was really important is agreeing on principles from the beginning. So the first 3 to 4 meetings were really about big principles. For example, is this report at the end of the day going to be a set of kind of recommendations that are going to be budget neutral or not? So, that, as you know, politics can really like stop quickly the minute you're just asking for more resources. And so we debated that quite a bit. And I'll confess, there were actually some folks that were part of the group who left because we landed on the importance of a budget neutral set of propositions, which is why it's called rebalancing, right? So there are not any concrete recommendations in that report that, that say very specifically, like we need more money to do X, right? We were really careful about that. So that was one principle that we started with. The second principle was, what content are we going to talk about? And what ranges of children? Children span 0 to 18. I just gave you a little snapshot of the complications of just the 0 to 3-year-old.
Right.
And so, I think we landed on a very important, diverse set of topics, but we also agreed to focus on children less than 13. There is one chapter, chapter 6, that is about teens. So we didn't, I'll confess, I kind of advocated to make sure that we weren't saying that we shouldn't invest in teens. Being a parent of teenagers and young adults myself. And so I was the one who got to write that chapter. So that's what happens when you.
That's what happens. Yeah.
Yeah. And so that was useful. That was sort of a big principle. The other was we decided that we were very comfortable with making some normative statements, right? And so what are our values? What are the country's values? How can we agree on these values? And so you see the thread of those principles actually with every chapter.
Yeah.
So that's sort of a little bit about process. And, there was a lot of details of a particular topic. I will say some of the things that were the most difficult to get on the same page in terms of consensus had to do with kind of family structure, marriage, and family stability. Right, there are different views about how much to focus on marriage, for example, formal commitment, legal commitment, caregiving adults, the range of all that language. And then the second one that I think took a lot of sort of high level to low level principle was, how do we talk about something like an expanded child tax credit, or going beyond what the earned income tax credit is, right? So how do we get to folks who have super low earnings and aren't engaging with the tax system? Why do we need to make this conditioned on work, right? All of those. And I think we landed in a really important space there too, which was sort of to be behind some kind of expansion of the child tax credit. And just to note there that was viewed as very pro-family as well as pro-child investment, right? So this idea, and the more conservative views on the table, this was really striking to me that we haven't had as a country a universal pro-family policy. And so providing resources to support families, to support having more children, to defray the cost of having children, was actually a kind of a point of agreement, which was super interesting for me.
Fascinating. Well, unfortunately, that study, right, a report is publicly available, so those in our audience can go find it on the Rebalancing Children First. Is that the full title? I think.
Yeah,
yeah.
I also had a chance. The dean of the Duke Stanford School hosts a podcast called 360, and she had a chat with myself and Michael Strain, which I also encourage. It was just like a fun little chat, and he offers some of his perspectives on how do you gain consensus.
Yeah. So if the audience is gonna go for a walk or something, they can hit play.
Yeah, you can hit the podcast.
Yeah, hit the podcast. So we have just a couple minutes. If folks have questions, we've covered a lot of ground. So in some ways it might be challenging or overwhelming to come up with questions. But great. Trita Poole, can you come join us?
I will. Let me see if I can get my camera on, if it's working properly.
Yeah.
Hi, I'm Dr. Trita Poole, Associate Professor of Psychology at Juniata College, and I'm also the PI of an NEH Connections grant looking at rural poverty in place.
Oh, wonderful.
And so two questions. One is, what other sort of qualitative data are you collecting to help you understand some of the nuances of the effect of that added money? And then two, I may have missed this, are you looking at rural areas? So what, how much of your sample, because we know that even having more money, if you live in a rural place, may not necessarily change or improve your poverty outcomes.
Absolutely. Thank you for raising that. So we were not able, for practical reasons, I'm going to say, it was very hard to think about launching this study and capturing rural populations in a way that would be representative in any loose way, in part because to make the study work, we had to have enough births kind of joining the sample through a hospital within a year to actually make this whole thing come together. So it was really hard to figure out how to include rural populations, again, in a way that we could actually say something really thoughtful about that group. So the folks who live in rural poverty are not included in our study. I appreciate your mentioning it. 2 decades ago or so, I worked with, I think it's, oh my gosh, I just forgot his name, but there is, so the Poverty Center at the University of Kentucky has a real focus on rural poverty. And some of the welfare reform studies that I got to work on, included counties that were more rural. And I agree with you, what you learn about circumstances and how safety net programs, and including cash, can and cannot do is extremely different. There's no, the infrastructure is so different. So we cannot say anything about folks who live in rural poverty. The qualitative data, we are, so it's 2 sites, New Orleans and the Twin Cities. We're not expanding that data collection in terms of more moms, because the idea is really to longitudinally follow the same group as they were experiencing the cash over time in the changing landscape. But the qualitative team has been successful in continuing to raise money so that we can keep talking to them frequently, every 6 to 9 months. And one of the big things that we want to make sure to do, and we put them in a sticky situation because we keep extending this cash gift. We really want to know what it's going to feel, when it ends. Like, are families in a stronger place or not? What's happening through all that adjustment period and cumulative income growth? And so we keep extending the cash gift, and they keep having to go back and fundraise, keep following the families. So now they're going to be following families for like 8 years, which is going to be incredible, right? From the birth of a child, all through that early period of development. I don't know if I answered your questions, but that's sort of what, yeah.
Thank you. I appreciate that.
Good. And we have time for maybe one more question.
Yeah, sure.
It's a short one. I don't know if we have a brave soul. Not seeing anyone. Well, as I say, thank you so much. I think that there's a lot of resources to dive in. I'm going to be teaching some classes that I look forward to using that report, for example, for part of it. And I can't wait to see the follow-up, the additional, there's going to be, I'm sure, a long string of papers coming out of that. Although, and I'm glad you gave us a flavor for the complexity of setting up sort of a massive research project like that. That's fantastic.
Well, thank you. Thank you for inviting me and sharing all of the amazing stuff that I've been privileged to kind of engage in.
Yeah, well, as I say, thank you so much for taking your time to come and visit with us. And to the audience, so we'll take a short break and we'll come back at 11:30, where we'll talk with some of the organizers of the Blue Ridge Mile Clinic, and we'll hear from them. So thanks again, Dr. Gennetian, and yes, we'll see you all. Everyone else, we'll see you in just a few minutes.